Dr. Ratana and I were talking about when we met each other out in San Francisco at that clinical training. He did the clinical, I was teaching for MIS on the business side. We were talking about how all on four out there is a bad term. And I was shocked because I'm going, whoa, I don't understand. And that's because out there, one of the brands on the market, one of the more famous ones, would only place 4 implants. I see we're using 1 existing and adding 5 more, correct? So this will be basically an all on 6. Where help, a big part of why we're wanting to film this is to help a patient understand if they're going in for a consultation and somebody just tries to maybe cut corners and only do 4 implants. I know there's a time, it's okay, but how would a patient know how many implants they should have on their case? And what should I be looking for here to go, oh, 6, that's great, versus 4 versus 8? Like how do you know how many?
Let's make this clear. Okay. The decision of how many implants to be placed is for the doctor, not for the patient.
Sure.
No, because sometimes patients come like, I want 6. No, it's not a matter of how many you want. It's the decision is mine now. I see the mouth. As implantologist, I want to give you the maximum occlusion, the maximum bite that you can get, with the most security implant placement all over, right? So I see like 4 might be in a small mouth or something. I cannot stack implants next to each other because you want 6. No, it doesn't stay here. If I have like mouth like this, wide mouth, your mouth is very good distribution, bone availability. Have this luxury to put 6 and also have the luxury to immediately loading all of those because of this condition. Some patients I have to put 8 and sometimes even 9 based on what I have, because I have maybe short implants, so I have to add more and not immediately loading them. So the final decision, with all my respect, has to be to the doctor. Of course, some doctors want to cut corners. I'm with you, I understand that. But in general, we should. Like, we are having this big procedure, and I will not risk this procedure because I wanted to save an implant here.
Sure.
It doesn't make any sense.
Sure. But there are, after having exposure to some of the doctors, good, bad, and otherwise I've seen out there, not all adhere to the same
and
deal.
by the way,
there's a reason
you
why.
can have 6 and 7 and 8, but placed wrong angulation.
Sure.
Can be restored. So it's not by the number. It's not by plugging this implant over there.
Sure.
It's where to put it, how to put them, what the environment of placing them, how you design your case. It's too many things. It's not just like one piece.
And as we said at the beginning, the diagnostic part is the most important part, because not every treatment is for every patient. That's why we customize the treatment for each patient. So depending on your case, we are planning, for example, in this case, you have tilted angle implants and all that, is because we plan it that way, based in your situation. Okay, so that's very important that, yes, sometimes you're not able to do exactly the same with other patients. So this is a customized option for each patient.
Okay,
I would like to, if you don't mind,
I'll let you finish and then I'll ask.
because this is maybe your mouth, right? I was able to put 6 here, right? Let me get another patient.
Okay.
So, patient like this right here, I can't put 6 on the top. There is no bone here to put 6. You can't do that. This is all the bone we have. On the front area, there is no bone whatsoever in the back over here. So I have to be, I'm confined by this area. And this patient, for example, I will not be able to give him all the way to the back. No bone, even in the pterygoid or something, it's not there. So that's why for this one, I have to put this 5, trying to, as much as I can, to maximize what I can give him, and at the same time give him the maximum occlusion I get. I cannot go all the way to the back like I'm doing with yours, for example. And this is 5. Don't tell me to put 6. I just can't. It's not by like how many you tell me to put. It's where I can put the maximum, for the maximum foundation.